So in this video, we're going to be going through the question I get asked quite a lot as a hip specialist physio. If I have surgery, is it going to be successful? What are the success rate for having surgery for hip impingement, aka FAI syndrome? So we're going to get stuck into it now. Now, surgery for FAI syndrome or hip impingement is a procedure that is done essentially to try and help people get back to what they want to get back to, especially for those who have been struggling and really unable to do the things that they want. FAI syndrome or hip impingement syndrome is a complicated problem. I'm not going to dive into the nitty-gritty of what that is in this video. I'll link that here so you can watch a video I've done which goes into it in a little bit more depth. But sometimes, in some cases, patients have rehab, do physio, and things don't work. And when they don't work, we need to kind of figure out what we do at that point. And a common theme with this is that surgery is an option. Surgery is a treatment intervention that is done to enable people to get back their functionality and get back to activity and get back to sport. Now, the thing is with that, there is some misconception that often physio might not be the best route and that surgery has to be the best route to getting it resolved. But the thing is also, the question is the surgery going to be the right thing for the patient? Is the surgery going to be successful? Is the surgery going to allow the hip to get back to what it wants to do? And there's some things that we're going to dive into in this video. We're going to go through what the research shows. We're going to go through really like what the kind of key things that we need to expect from a surgical outcome, and really like who does good and who doesn't. What are the predictors of good and bad outcomes? And we're going to dive into that now. Now, the thing is with FAI syndrome and hip impingement, it's just ultimately coming down to a skeletal or a morphological driver to it. So if you have a cam morphology or a pincer morphology, usually if you've got true FAI syndrome or hip impingement, the thing that hurts inside the hip, the labrum and the cartilage surfaces, is often impacted as a result of these structural causes. Now, in some cases, some patients can do quite well. They can modify their activity, they can change the way they move, rehab it, and do really quite well from a rehab perspective with physio without the need of having surgery. Now, on the other hand, some people try the physio and they don't do as well and they struggle. And in those cases, some are referred to orthopedic consultants to have surgery, and the surgery itself can be quite a big thing to recover from. But the thing is, and this is the thing that you have to understand, FAI syndrome is a risk factor for arthritis. Arthritis is obviously the thing that causes the biggest burden in adults when it comes to hip pain in adulthood. So we know that OA is a really big thing and a big problem worldwide, and often some of the treatment for that, when it fails interventionally, might be a hip replacement. But with FAI syndrome, we're talking about a young adult population. So we want to try and negate the need for having a hip replacement. So a hip arthroscopy, the keyhole procedure, this is a procedure which is done from a perspective of trying to keep the hip healthy. So it's kind of a hip preservation procedure, right? Now, considering that this is a hip preservation procedure, we also want the hip to be able to do as much as possible afterwards. There's no point in having the surgery and then not being able to do the things that you want. But there is a misconception out there that surgery has to be the first choice, because if you have a ball on the joint, the cam morphology, the little bump, or a pincer, this overhang, that the only way that you can resolve it is by going in, having surgery and shaving it all down. But you have to consider that the cam morphology can be present in a pain-free hip, the pincer morphology can be present in a pain-free hip, and also the labral tears, which are the things that are actually hurting, can also be present in a pain-free hip. So to make the decision to have surgery has to be a really considered and a conversation that is made with the surgeon and the physio and the patient to really understand whether or not it's a suitable option. Now, let's talk about the success rate, because some patients are worried. There is a narrative or a misconception that if you have surgery for a hip problem like FAI syndrome, the arthroscopy outcomes are a bit hit and miss. And it makes patients feel anxious. It makes patients feel concerned that, it's not something that they should really look into. However, that narrative is flawed. That perception, that understanding of what the outcomes are flawed. Let me go into it now for you. So The recovery is dependent on a number of factors. The really simple black and white factors are you need to have a surgeon that is skilled, that does it a lot, that really knows what they're doing, so you're in safe hands. The second thing is you need to have your rehab optimized. You need to have good physiotherapy afterwards to help optimize your outcomes, to make it a success. You can't make it a success with just a good surgeon and poor rehab, and you can't make it a success with someone who doesn't do it as much and really good rehab. These two things come hand in hand. The other elephant in the room is we need to make sure that what we're treating is the right condition. I'm going to go through that as the last point in this video because that's something that definitely can impact outcomes but is often overlooked. Now let's talk about the success rate. So while I'm talking, I'm going to show up a couple of pictures of studies that look into the outcomes of hip arthroscopy for FAI syndrome that demonstrate the outcomes that sometimes most patients aren't aware of. Now, none of this is ever going to be 100%. You know, we've got studies like this, which has over 1,000 patients that were involved, that demonstrates a really good level of outcome in regards to what patient satisfaction scores they're looking at, patient-related outcome measures, and really getting back to a decent level of activity. So we know that studies like this one, and also some of these other ones that I'm going to pop up now, that demonstrate the outcomes for patients during follow-ups from 2 to 5 to 10 years, show that actually you can get a really positive outcome from having surgery. Now that's really important to consider, but on one hand we have to understand that this isn't 100%. Even though the survivorship demonstrates good outcomes, even though that patient satisfaction and the patient reported outcome measures, which are tools that are used to understand, you know, how much impact it's having on your sporting activity, your social activity, your day-to-day activities. Those are what the patient reported outcome measures are. It's great to see these massive improvements that persist and consistently stay good for a long period of time afterwards. But it's never 100%. You've still got that kind of 5-10% plus cohort that sometimes don't do as well. And we have to understand how we can improve that. But we also are still learning. We're still learning about the patients who do report that they're doing well and they're doing activity and exercise, but at what level? And that's a thing to consider, because you could be a professional athlete that has the surgery and gets back to doing pretty much most of what the general population would do. You could even get back to doing the sport that you were doing at a professional level, but we still are trying to understand, like, at what quality are you able to get back to? And it's a really challenging condition to understand the implications of all of those things for everybody, because the context will vary. And also pain is complicated. Pain isn't just labral tear and structure and we repair it. You know, pain is governed by the brain, and that whole process is quite complicated. Now, the other thing to consider is how can we understand the things that will impact performance afterwards and outcomes? So how can we try and influence that? Well, there are positive and negative predictors to outcomes. So things that will enable people able to do better or worse, and understanding that will help. So you have physical predictors and psychological predictors. What I mean by psychological predictors is if you have someone who is anxious and stressed, episodes of kind of like poorer emotional well-being and mental health history, maybe those that catastrophize and worry a lot or in a hypervigilant state for a long period of time, often those patients don't do as well. And that's the same for many orthopedic procedures. And then we have the physical stuff. We have the hip joint that's maybe gone along the route of becoming a little bit more unhealthy. So like we have that arthritic spectrum of severe, moderate, mild, and then we've got the precursors to arthritis like the bony edema and cysts and things like that. And then we have the risk factors like FAI being one of them. So if your risk factor then shows that your hip is turning into from just having a labral tear to these precursors and the FAI syndrome with the cysts and the bony edema and a reduction in joint space, and often those hips don't tend to do as well, and a lot of surgeons who see these patients may not even operate on them with those kind of issues. But we've also got to consider the massive elephant in the room, which is the thing that I mentioned before in this video, which is understanding whether or not this condition is actually the thing that we're dealing with. And we have to understand, and I'm really trying to not forget the fact that FAI syndrome may well be picked up on X-ray and an MRI in regards to an imaging workup, but there is also the fact that sometimes hip dysplasia can coexist with the FAI hip as well. So there are hips which sometimes may have FAI syndrome and hip dysplasia, and the thing that hurts in these cases are the same. It could be the articular surface, it could be the labrum, it could even be the periarticular capsule, the ligaments, but arguably the thing that hurts might be the same, but the condition is very, very different. And when that's not picked up and the treatment is for something that is incorrect, i.e. hip arthroscopy for FAI syndrome, well, sometimes that can make the hip dysplasia or the instability of the joint worse. And when that happens, then what's also going to happen is your outcomes are going to be poorer, the pain is going to be higher. We haven't addressed the problem, we've addressed maybe the effect of the problem. And that's why really understanding if you're going to have surgery for FAI syndrome, you have to make sure that the treatment is for the right thing and the right condition. And if it is, then great. But what I would suggest is if you have had surgery and you are struggling to rehab it afterwards, or even if you are thinking about having surgery and you still want to understand a bit more about what the condition is, watch these videos and let me know your thoughts.